I'm Slade. I'm the Deputy National Lead for Cardiovascular Disease Prevention at Public Health England, and I'm chairing today's meeting. And today we have the guest speaker, Professor Neil Poulter, who is the Professor of Preventive Cardiovascular Medicine at Imperial College London and President of the International Society of Hypertension. And he'll be speaking about the topic of May Measurement Month. The webinar session will take the format of a 20-minute presentation by Professor Poulter and then a question and answer session at the end where everyone will get an opportunity to ask a question. So without further ado, please take it away, Neil.
Thank you very much indeed, Slade, and good afternoon, everybody. I'm delighted to have this chance to talk you through, give you an overview of May Measurement Month in 2017 and what's going to happen in 2018. Next slide, please. So, by way of background, next slide, this gives, I suppose, the mission statement of ISH right there in the middle. We want to promote and encourage the advancement of scientific research and knowledge and its application to the prevention and management of heart disease and stroke in hypertension and related cardiovascular diseases around the world. And it really was, the idea was to take World Hypertension Day, which was May 17th, and that was invented by the World Hypertension League, shown at the bottom there, their logo. We want to make that writ large and convert it into May Measurement Month. Next slide, please. So what is May Measurement Month? Well, it was launched last year, the idea having arisen the previous September when I became president of the ISH. And what we wanted to do was put a spotlight on the increasing access to blood pressure screening as potentially the most effective way to reduce hypertension's adverse toll on health. And because for the reasons I'll show you, we think it deserves not just a day, but a whole month of screening. Next slide, please.
Yeah, I know. Oh, that's all right.
Next slide, please. So here's some of the background. Raised blood pressure continues to be the biggest contributor to the global burden of disease and to global mortality, leading to 9.4 million deaths each year. I wrote that in 2015. That figure is now closer to 10.5 million deaths each year. So we think we deserve more than a day to bring focus onto screening blood pressure, and hence the month. Next slide, please. As you'll appreciate, raised blood pressure kills you really through cardiovascular disease. And because that affects a third of adults in the world, it's probably the largest epidemic that mankind has ever experienced. Next slide, please. So now let's come back to focusing on awareness. These are data in the table from the PURE study, collected from all around the world. And in the first column, it stratifies the hypertensive patients that were screened as to their origin of their national income. And you see it stratifies from high down to low. And then as you move across the next column, the numbers involved of hypertensives, then we go into awareness, treatment and control. And to simplify things, as you go from high to low, whether it's awareness, treatment or control, things get worse in the lower income countries, as you might expect. But let's just focus on the row at the bottom there, the total global appearance. And what you see is that awareness at a global level is less than half of people with hypertensive are aware of their hypertension. So if you then move right to the treated, you see that most of those who are aware get treated. And then if you go right again, of those who are treated, there's a big drop off between treated and control. Only a third of those who are treated are getting controlled to current targets. And if we're move on to American guidance, those targets will get lower. But let's just pretend for the sake of argument, we treat everybody perfectly. Those whom we currently treat, if we did that perfectly, that would give us 40.6% controlled. And that means that 60% are left totally untouched. The bulk of the problem will remain, even if our current practices, we get perfect control, 60% of the problem, the cardiovascular events attributable to blood pressure, will remain. So it struck me that it was critical to open the gateway to improving control and the ultimate burden caused by blood pressure. We have to improve awareness. Less than half of people with high blood pressure know they've got it, and that's got to change. Next slide, please. So in 2017, the World Hypertension Day used to be May 17th, invented by the World Hypertension League. We agreed with them that we'd expand it to become May Measurement Month. And ultimately, we didn't say this at the time, but that's what we're talking about now. We're going to keep doing this until awareness around the world gets right up there into the 90s. That's what we need to do. Next slide, please. So this was funded essentially by the International Society of Hypertension and volunteers from all around the world. People volunteered to support this. We had small donations, financial donations from Servier and CDC, and we also got 20,000 blood pressure machines from Omron. But the bulk of the financial input, the core funding, came from the International Society of Hypertension, which is a charity. Next slide, please. So here we go, the results of MMM 17. The idea is what we did is through our network of hypertension societies, we sought a country leader who was appointed, agreed to take part and run their country. There may be more than one leader per country. And it was their job, his job, her job, to be responsible for getting the ethics and for coordinating national efforts. And essentially that effort was a cross-sectional survey of volunteers aged 18 and above who ideally had not had their blood pressures measured in the last year. Clearly we weren't going to turn anybody away, that wasn't the way to go, but really we wanted to look at people who were 18 and above who hadn't had their blood pressures measured sometime in the last year. And again, ideally we wanted to record 3 sitting blood pressures, along with, then we gave a questionnaire with information about demographic, lifestyle and environmental factors. Next slide, please. So what were the key questions we were asking? Well, our aim was to increase awareness. So that could only really be measured by things like how many countries did we get involved, how many countries with a big screen, bigger than they'd ever had before. We can come back to that. And how many screenees could we get involved? That was our measure of awareness, if you like, as was the number of people identified who had untreated hypertension or inadequately treated hypertension. In this study, like in most, we defined hypertension as a systolic as 140 and above, and or a diastolic of 90 above, or being on antihypertensive medication. In addition to this, in light of the other information we collected, we also evaluated some associations between blood pressure and various screening characteristics, which is a kind of academic spin-off from this cross-sectional survey. But our main aim was to raise awareness at the national level, in societal level, and at the individuals whose blood pressures were raised. Next slide, please. So here we go. It truly was global. The red bits are the areas that the countries that took part. And it was the largest synchronized blood pressure screening ever to take place in such a short time. There have been bigger compilations of data, but never collected in such a short time at the same time. And over 100 countries took part, but about 20 of those have got tiny numbers, and we were very uncertain about the origins of those data and the validity of it. So we took an arbitrary decision to say that we would analyze the data from the 80 of the countries where had at least 10 screenees per country. And as a total, we had over 1.2 million screenees involved. Next slide, please. And here you see some of the pictures which we received. We got videos, we got pictures, just fantastic, heartwarming feedback from all over the world. You'll notice top left, perhaps suboptimal technique for a sitting blood pressure, but nevertheless, marvelous worldwide support. People did extraordinary things, volunteering to get involved, both to measure the blood pressures and to get it measured. Next slide, please. And as you can see from the previous collage, screenings took place in all sorts of places: churches, mosques, marketplace, community areas, universities, pharmacies, supermarkets, factories, and doorsteps. Just a fantastic array of sites and situations around the world. Next slide, please. So let's just talk about how we promoted May Measurement Month in 2017. Next slide. What we did is try to use celebrity endorsement to get social media, press and television coverage. The examples are some of the local celebrities who'd suffered from hypertension themselves, and bottom left was a gospel singer in Kenya whose stage name was Size 8. Unusual stage name, but she did a fantastic job and produced a video saying to people she'd had preeclampsia, and she told people about that and said, go and get your blood pressure measured. You see at the top of that triangle, bottom left, Pima is Swahili for measure, so Pima pressure, go and get it measured. Then moving on to the middle, we got into Wales, where football rather than rugby surprisingly was selected to use celebrities there to get people involved. And on the right hand side, the former president of the Philippines, and once again we've on this occasion approached the president of the Philippines to be a global ambassador for us. So we had all sorts of people. We had live broadcasts and radio presenters being measured at a screening centre in Ireland. All sorts of ways of trying to get celebrity endorsement and get the media involved. Next slide, please. We had branded T-shirts and caps and MMM banners, and you can see here in Pakistan this mass march that took place, creating noise and awareness around the streets. Absolutely fantastic effort by all the people, and this one from Pakistan. Next slide, please. Part of the recruitment process was to engage rural community leaders and to make sure they understood why was this being done, what was it for. And you see examples here from Malawi, where having had discussions with elders in the area, they then agreed that this was a good thing to do, and so screening days could be arranged for the general population to show up and get their pressures measured. Next slide, please. In the rural areas, we had street plays for awareness of the issue. There were mobile blood pressure screening units, you see there bottom left in the van, and there were door-to-door offers of blood pressure testing, and it said they're often once in a lifetime opportunity for participants to get involved. This particular area in northern India, it was about just under 90% of people had never ever had their blood pressures measured at all. So this really makes a difference. Next slide, please. So where's this going to go? Well, we're sitting on at the moment. We're waiting. We've been back to the referees to respond to the publication we've submitted in a prestigious journal, and we hope it's going to get there. That's the first of the global publication. There may well be others, I think. We then hope there'll be regional and national publications, and maybe an ethnic-based publications as well. We wait and see how things are going. But we're literally, as we sit here now, we're waiting to hear back from the referees. We've had one response from them. This is a response from our rewrite at the referees' recommendations. So we wait and see and keep our fingers crossed. Next slide, please. So what are we going to do this year? Well, the aims and objectives are pretty similar. Number one, to increase awareness of the health issues around high blood pressure in the public and healthcare arenas. And so we want people to get their blood pressure measured. And by doing so, we hope to create scientific evidence to inform and influence health policy. We appreciate these are non-representative samples necessarily, but nevertheless, big populations in 34 countries that we know about. It was the biggest blood pressure screen ever to take place. So this is bound to create noise, and we want to use that sort of information to support and get health policy change to increase access to blood pressure screening. So we're hoping, maybe having got 1.2 million last time, we hope to get another 1.5 million this year. And again, ideally they shouldn't have had their blood pressures measured for over a year. So by design, this is not a representative sample. But we also hope not only to get a slightly bigger screen, but we want to get the quality of the data better. And we'll do that by virtue of having a much better app than we were able to use in 2017. Next slide, please. So, how do we do it? Well, the first thing, increase public awareness and engagement to drive people to go to the screenings, and we'll do that hopefully through a media campaign, celebrity endorsement and social media engagement, all of which we've got to one extent or another. Then we want to make it easier to collect, record and submit the data, and that we're doing through a new app. In 2017, only 8% came through the app. It wasn't flexible. It wasn't fit for purpose, really, as it turned out. And the purpose, obviously, was so massively variable that was not really the fault of the developers. But we've now got a much better app, and I'll tell you about that. And then thirdly, we want to deliver greater impact through updated promotional materials. Once we get these data, hopefully we'll have it collected by, at the very latest, all collated together by July, and then we will get this published quickly, much more quickly and much more effectively, with, I think, a better quality database, we hope. Next slide, please. So, simple focus MMM messages, a simple measure to save lives. Get your blood pressure measured, check your blood pressure. And three key pieces of information. It's the #1 contributing risk factor for global death. It's, as I said, over 10 million lives are lost each year due to raised blood pressure, and only half of people with high blood pressure know it. It just has to change. We have got to get people aware and get them to get their blood pressures measured. Next slide, please. I apologize for this one, but there you go. The guy in the red shirt is my son, Will Poulter, who is reasonably well known if you're into films, and he's kindly agreed, and yet again agreed this year, to help us. And Will brings with him increased awareness through his network of Twitter and all the rest of it. And through the content we can create interesting stuff which we can share on social media, as well as getting press coverage. Indeed, we've got slots on Good Morning, is it called Good Morning Britain, and another one with Victoria Derbyshire on BBC. So so far two television appearances to talk about the global campaign, and hopefully also to raise awareness, particularly in UK. Next slide, please. So how's that working? Well, April, we've got the pre-campaign, we've got a recruitment drive, and there'll be a 10-day countdown to the 1st of May. That's happening now. And 1 tip per day for controlling blood pressure is being launched. And then the day itself in May, we've got celebrity videos, we've got an ISH video, we have a public infographic for sharing. And then between May and June, we'll be sharing the MMM stories through all those blobs that you see on the right, which mean probably a lot more to you than they do to me. Next slide, please. Facebook profile fame. To encourage the public to promote MMM virally through May. This is the sort of thing that's Lisa Woodward, who's our communications manager. She's driving the communications, and that's Lisa. This is how she's going to do it. And I think the idea is this spreads amongst her friends and her friends and her friends and their friends and their friends, etc. Next slide, please. We've got resources, digital resources are available for country leaders to create these MMM branding and awareness. There's the roller banner on the right-hand side. There's leaflets and posters, as you see there, the t-shirts down the bottom, and social media content through videos and articles. Next slide, please. Resources for the participants. There's a participant fact sheet on the left. That gives them a simple story about high blood pressure. Then moving across to the right, you've got a BP record card, so the patient can write down what their blood pressure is and a date. And we'll be using the mean of the second and third reading out of 3 seated readings. And then the third box along is what we recommend that you do. Now, this will vary from country to country. There's no point in saying pop along to see your doctor in certain parts of the world because there aren't any. So that'll be tailored to local conditions. But in our setting, of course, in UK, that's much easier. And then bottom right, you've got the 10 top tips. Again, this is being modified around the world because getting beetroot juice in a supermarket won't work in various parts of the world, obviously. So they've got to be tailored to local resources and beliefs and culture, etc. But that gives you an idea that these things have been produced and are available. Next slide, please. We've also got a global media campaign this year, and that's being driven by Servier. They came to us and said they wanted to have a campaign to drive blood pressure measurement, and since we were already in the business, they'd like to join in with us, and we were delighted. We were conscious of the fact that might be perceived as farmer involvement and that we were biased, etc., etc., but we put this to our executive, and I think we all felt that this was a perfectly reasonable thing to do, because in the end it's going to drive what we want to do, and that is to raise awareness for people to get their blood pressures measured. And the Survey campaign running up to MMM is that we think it'll increase public awareness and drive in interest. And MMM countries also got the opportunity of linking up with Survey officers for support. They don't have to support us, but I think Survey Central have spoken to all their affiliates. I think there's 126 of them, and said, please support if you can, how you can, however you like, the May Measurement Month campaign. And that's been building through April to kick off at 1. And the idea is, you see the idea of the thing, it's really, these are kids talking to their parents. You know, the usual thing, because I say so. Well, these are the kids saying to their parents or grandparents, because I say so, get your blood pressure measured. And there are variations on that theme, and a couple of the posters you see on the right there. Next slide, please. So I said we've got a better app. We needed one, but we have got one. It's simple. The data collection submission are much easier and faster than the previous app. If anyone saw it last time. It's versatile. It works on a desktop and a laptop, Android, iOS, mobile phone, or tablet. And it can be collected offline, where internet doesn't exist, and this was the huge problem last time. If it didn't exist, then you couldn't enter it on the app. Now you can, and then download it once the Wi-Fi is available. We're trying to save the effort of the volunteer workers, so there are various default settings which will reduce duplication of data entry. So if they're on their app, they can say where they are. They don't have to enter that every time, or the date every time, etc. That sort of thing. And the other thing is, for those who can't for some reason get access to any way of using the app, then we've got a scan and capture functionality where if the data are written down on the form that we've provided with the same data, then the national leader or equivalent can use the app and photograph what has been scanned on the form, taken on the form. That will be scanned and it'll come straight through to us. And that's all available in several languages, including English and Hindi. Next slide, please. So this is an appeal for you all to be part of it. We want UK to do better than they did last time. Reasonable effort last time, but I was disappointed that we didn't get much traction with the British Hypertension Society, now called the British and Irish Hypertension Society. But we've got some national leaders, you see them there, and they're all doing a great job to try and promote this. Franco in UK, and as president of the BIHS, is kind of the boss of the whole of UK and Ireland. Wales is John Cockcroft and Barry MacDonald, Adrian Brady in Scotland, and Eamon Dolan in Ireland. If you're interested, if you'd like to set up a site, please, we'd love you to do that. One day will do. You can get about 30 people screened in a day very comfortably. So if any chance of people getting involved, please do so, and you can follow through May Measure to spread the word and try and make this a bigger campaign within the UK and indeed around the world if you have any influence. Next slide, please. That's it. There's the website, www.maymeasure.com. Thank you very much indeed for listening, and please help us to expand the traction within UK and Ireland.
Thank you.
So over to you, Slade.
Thank you very much, Neil, for such an insightful webinar on May Measurement Month. So we're now going to stop the recording, I believe.